Once we have about 20 to 30 attendees or so, we'll be able to start the session for real.
Yeah, I think the webinar is live. People are joining in.
Yes. So we're reaching about 20 attendees right now, and let's just wait for a couple more minutes until a few more people join in, and then we'll get started. Oh, and in the meantime, let me share my screen.
Yeah.
Yeah. All right then. Is everyone able to view my screen? Okay. So welcome everybody. This is our live webinar that we're conducting on the transformation of healthcare operations. How can decision makers drive control and visibility? So quickly, before we get started with the webinar, I'll be able to run you through the structure of the webinar itself and what you can expect staying here for this 40-minute session. So the webinar, we have structured this session as a 20-minute panel discussion plus a 20 minutes audience Q&A. So you'll be able to pose all of your questions at the end of the webinar. For the duration of the panel, however, panel discussion, which is to say, the participants will be muted. You could raise your hands or type in your questions and in the question and answer box at the bottom of your screen. I'd also like to inform you that the slides and the recording of this webinar will be sent to you directly to the email that you registered to this webinar with. In between the session, we'll be able to have a quick poll, an audience poll to sort of something that engages and sort of keeps this level within the webinar directly. Okay, moving on to the next screen. So let me quickly run you through the agenda of the webinar itself. So I'll be able to give you a quick introduction to both Facilio and to Eurohealth systems. And then we'll be able to launch into the meat of the webinar where Mr. Hani and Vaishnavi will be talking about the transformation of healthcare operations and the role of technology in driving operational change. Additionally, they'll be addressing the main points, which is the crux of the webinar, which is how to address the gap between O&M and real estate leadership as it is right now, which includes what more can be done to CMMS itself to sort of rethink its boundaries, to have visibility and full control over all your initiatives, and also how decision makers themselves can extract maximum value out of the software that they're currently using, post which we'll be able to jump in quickly to the audience Q&A session. All right, we'll get started with the introduction to Facilio. So if you've attended our previous webinars, you'll be aware that Facilio is a property operations cloud platform that aggregates all of your data, all your system data to optimize performance and give you complete control over all of your operational initiatives, all from one place. So we're a market-leading property operations cloud platform. We've been recognized as such as a product leader in IoT-driven property operations by top research and analyst firms. Additionally, we've also been ranked and awarded by global media companies as CMMS Software of the Year consecutively. We have an expanding and growing list of customers and partners across the globe, all the way from the US, UK, Middle East to Australia and New Zealand as well. So now quickly jumping into EuroHealth. So meet EuroHealth, a Dubai-based specialized firm in healthcare consultancy. EuroHealth is working in the primary area of hospital consultation, development, and management. It's experienced in hospital planning, development, and procurement of medical equipment. They pride themselves on being cost-effective and efficient operationally, both while enhancing and streamlining existing processes, while also implementing new initiatives. And it is my pleasure to welcome Mr. Hani Sattar, who is the Director of EuroHealth Systems, who has graciously agreed to share his decades-long insights and expertise on managing portfolio operations and helping real estate leaders to sort of bridge the gap between O&M and leadership as it exists today. So Mr. Hani, I hand over the floor to you. Please introduce yourself and also walk us, and Vaishnavi and yourself will be able to walk us through the meat of the webinar.
Thank you, Chinmay, and good afternoon, everybody. It's a pleasure to be here with all of you. My name is again Hani Abdul Sattar. I am the director for EuroHealth Systems. We're actually I head the consulting arm for one of the largest private healthcare providers within the region. As Chinmay was saying, our focus areas are hospital consultancy. We basically help providers, promoters, as well as investors set up medical facilities across the Middle East. And as part of that, we also offer other services such as facility management is something that we have taken on board for the last 1 year, where we currently are taking care of over close to about 400 facilities across the GCC. So in a nutshell, we do everything pretty much in the healthcare space.
Thank you. Thank you so much for being here with us, Mr. Hani. Pleasure always talking to industry leaders, especially the joy is twofold when we have our customers on the panel. So I'm just going to jump right into the session. I have very specific questions today for you, Mr. Hani, around healthcare operations and the role of technology in it. But I'm personally excited about the panel that we have today, because we often talk about technology for operations, but never pin it down in the context of how important it is to, tailor it around executive needs. Right. And our discussion today is going to be largely directed towards that. But let's zoom out a bit before that and talk about how has healthcare operations as a function transformed in the last couple of years? Is there a significant shift, especially with the pandemic and post-pandemic, that you have witnessed between, how things were done earlier versus how it's done today?
Yeah, I think healthcare providers in the past have really, have not really focused a lot on core operations, primarily, you know, we were an economy where we were building the healthcare infrastructure. So I think everybody has been focusing a lot on building that infrastructure. I would say being in Dubai, you know, which is becoming a mature market in that, the infrastructure is there. And I think with the pandemic, it has become very evident, especially during times of needs. How do we optimize our resources, our you know, operations, to ensure that we are able to react to the sudden need that may suddenly spurt up, and how do we come out successfully? So I think there's also been other factors such as insurance, at least in this country, where you know, the carriers have been really focusing on how do they push the providers to reduce the cost. And I think that's been another big factor to drive how, you know, providers react to seeing how to optimize their operations. So there's been several factors that have come into play to push the providers to focus much more on patient experience, patient delivery, improving the outcomes by reducing their cost, and, you know, and optimizing their operations.
Right. That makes sense. Because we also spoke earlier, and you spoke about Western influence and how being operationally effective is right now the top of the mind for increasingly in this region. But we're also seeing that even globally the operational needs are growing beyond what was conventionally considered just asset and maintenance management, like you just said. There's so much more to your responsibilities, from making spending decisions to prioritizing patient care and engagement and whatnot. So can you tell us a bit about how technology needs to evolve to meet these growing needs, and what are some of the obvious and not so obvious challenges in doing so with these evolving needs?
Yeah, so as I was saying, as operations has been getting a lot of importance in among the business leaders to see how do we optimize it. The fundamental question is, do you have all the information that you require to make those business decisions that can drive your business, right? And I think that is still an evolving process with many of the leading healthcare providers, because as they've been growing, they might be having different verticals, with multiple systems in play. And what happens is, when we sit as senior management staff, what's most important to us is to be able to have a 40,000 feet view of the business, for which we need the information that has to be compiled and brought to us that makes sense for us to be able to make intelligent decisions. And that is something that is still lacking, I would say, especially in our industry. And there's a big, huge focus on seeing how do we bring technology on board, and not just bringing technology, but how do we make that work in a manner that provides us the information that we require. We find a lot of times people go out there looking for different softwares or systems, and they do some studies and they bring it on board. Now, there's multiple challenges that they have. It's just not about bringing technology. It's about seeing how do you implement that right, and extract the information out of that will enable you to make intelligent business decisions. And I think that's a big area where people need to focus and see how they can not just bring technology, but see how do they extrapolate out of that technology to help them advance forward.
Yeah. Facilio, our narrative since so long, has always been from, it's also been founder driven, that technology is only one part of the puzzle, right? It's also about how do you extract the maximum value of the technology, and how easy does the technology make it also for the industry, for the stakeholders to extract value out of it? So at this point, though I actually want to also include our attendees here today and understand probably their challenges and their tech maturity in solving C-suite needs before going further. Chinmay, can we launch a quick poll here to understand what operational visibility looks like in multiple portfolios who are attending today, to just see where we are we in line with the discussion today or not?
Yes, so I have the poll ready with me, Vai. Shall we be able to launch it in just 1 minute? Yes, so the poll is now live and you'll be able to see it on your screen. For the audience, we'll be able to keep it on for about a minute or two, and then we'll be able to see the results as well.
Yeah, this poll is based on our own experience of talking to different customers and finding customers in various different maturity of their operational visibility, right? There are some people who are still chasing people for reports on spreadsheets, emails, doing these on manual systems. There are people who are doing integration projects between multiple sources, multiple systems to consolidate data and then extracting value out of the technology. Some have readily available reports, but they are equipment and site level based, and some level of integration requires to get a 360 or a bird's eye view, like Mr. Hani just mentioned. And some people actually have, they are much ahead in the maturity by having enterprise reporting and BI in place right within their Kpis systems. So just to understand what's the ratio here.
We've pulled in a considerable amount of votes here, Vaish, as you can see. I'm sure.
No, we're not able to see. I think we'll be able to see when it's published.
Okay, only at the end of the poll. All right. All right. I'll just leave it on for about 10 seconds more. If you haven't already voted, please let us know if this is a problem that which statement best describes the operational visibility in your portfolio today. If you have manual or time-consuming processes, or if you've got those insights and you're not quite sure how to act on them, or if you have them all readily available, which enables you in turn to make all of those critical decisions that require the data that you're working with. All right. All right, I'll just close the poll out here. And let me share these results as well.
That's interesting.
Yes.
Okay. It's clear that there are varying levels of maturity in how people are approaching operational visibility today and extracting value out of the systems that they have today. So, Mr. Hani, it's quite clear that it isn't exactly as easy or straightforward as it might be in enterprise software elsewhere. And I'm wondering if it's because predominantly Kpis and Cmms systems were conceived as system of records and mainly for technicians to use as maintenance systems, and they have been built so, and they are continuing to be built so, and there's a gap between the evolving needs today and what's how it's been conceived earlier. So can you advise on what it takes to go beyond record keeping and easily extract value for decision makers like you today? And it would be great if you can walk us through some real world examples of things you have implemented and you want to implement also in the near future.
Yeah. So I think one of the things that I can probably speak about is when we took over the for a large healthcare provider having close to 400 facilities across the region, what we found is, obviously everybody was working in silos. No one is really recording things in a consistent manner. PPMs are being done at some places they're not being done. Consolidation is not happening, on procurement aspects. What is this? The spend is not really being monitored. There's vague spends that's happening. There were a lot of areas where we were just losing money. Now, bringing in a solution that is able to, first of all, put everything together, whereby you have a bird's eye view, you can see everything, you can record everything, is great. That's the first step that you need to do, right? So at least you know what is happening. I think the next step is then to sit and analyze and see, where is that spend happening? Are things being done as it should be, so that you're able to achieve the results that you had set to achieve. So that's the next step of the analysis. And the third step is to see, after analyzing it, what can you do to better the services, to improve the life cycle of your equipments, to see how do you reduce your cost. Are there opportunities for you to maybe consolidate your procurement? So you can look at a lot of different aspects of that once you've analyzed the data. If I had to use a specific example, I would say, just as a simple aspect, if I had to look at PPMs were not being done across the board, maybe 20-30%, because that used to be managed by operations, clinical operations team, which obviously the emphasis of a building operation management is not of utmost importance to them, because their focus area is different. So when we are able to, now record and see, we know what is the productivity of our staff. We are now able to see, are our equipments getting the attention that they need at the right time, so that we don't focus on reactive maintenance, we focus on proactive maintenance, right? Preventive maintenance. So obviously that improves the quality of the services, the equipment lifespan, things function a lot better than what they are. So I would say that, that's what I would sum up to answer your question.
Got it. Just as a follow-up question, I think someone has already raised that question here, is what does data-driven decision mean to you? So when you say that, all of these information are readily available, is going to be useful to you, can you paint a picture of how a decision without data might look like, and how the decision actually improved with the help of data that was available to you? I think we already, yeah.
So I can give you a very, very simple, answer to that, of an example that, may sound very small, but, it's just to capture the context of the conversation, right? So when we first started looking at, we started looking at what were some of the calls that were coming out of the hospitals, we found that there were a lot of calls coming in for, door issues. Okay, maybe there's a handle issue, there's something to do with doors. Now, the facility management team at that point were just technicians. What we did was we saw the amount of calls coming in, and they would, these tickets would be there for weeks, because we wouldn't, be addressing them, and it somehow didn't seem to be a priority for people. Using that information, we just put a carpenter there, because we were calling a company, every 2 weeks to come and resolve issues. We were obviously spending money on that. By just using that information, we hired a carpenter, and suddenly all of that just vanished, right? So I mean, I know the example is very small and it's not a big deal, but it's just for you to understand that, 30% of my calls outs will come in at the hospitals because of an issue like that.
Yeah.
And because of that, we were spending money by, going outside and, hiring different people, companies to come and do it when we could have just addressed it right then and there. So that's, so when I say data driven, I think it's very important for us to understand. So if I have multiple facilities and I suddenly see there's repairs and maintenance happening, the expense of that is happening, especially at one center, then it gives me the ability to go in there and drill down into that data to see why is that expense coming up there? Is it something that can be addressed very easily, or is it something that is being ignored, which I need to address? So I think data, like I said, is extremely important. But if you do not utilize the data in an effective manner, then having the system makes no sense at all.
Yeah. I mean, call it a very small example, but I see, even as an outsider of this industry, I see the power of having this data and the solution that you provided. So that's the whole point, right? Like once you have the data, and it's a power of these individual organizations to make use of it in a way that it's going to impact their revenue, impact their customer experiences, then it just unlocks a whole huge potential for you and your organization at large. So we spoke about bird's eye visibility. We spoke about recording all that and getting visibility, B, then being able to gain some insights out of the data that is then available through analysis. Again, two key pillars for effectiveness. Just double clicking on that note, Mr. Hani, if the systems today would have to be, especially the KFM and the Cmms of today, would have to be redesigned or re-engineered to, as a tool that besides being useful for technicians is also extremely powerful for executives from a data-driven point of view. What kind of capabilities or what kind of reports or numbers would you like to have readily on your system? I mean, you spoke about some examples of it, but is there like a routine that you have, like, periodically I would like to check these kind of dashboards, these kind of reports, or this kind of information, not very specifically around this specific metric, but overall around maybe say certain performance, certain numbers that you would like to have as a senior management?
So I think, it's important, one, to, there's one aspect of it is, I would say the productive side, where you want to see if your team is able to meet the SLAs and KPIs that are defined to their customers, right? So that is one aspect of it that I think I would be very interested to understand and see that we are meeting that, so that if we are not, why are we not meeting it, and what can we do to make sure that we meet it? Because at the end of the day, it's important for us to ensure that the customer that we serve is getting everything that they need as we promised them. The second aspect of it for me would be from a cost perspective of, what is my spend as based to my previous spend? How are we able to contain the spend and reduce it? So everything based on, the cost element, spend element is something that I would have in the dashboard. Third, it would be good to also get, quarterly, regular feedbacks, so rating polls or so from the customers as to areas of where we can improve, and, I would also like to see, from an equipment standpoint, what, as part of their life cycle and stuff in terms of PPMs, what percentage of that is being done? Are we doing it as per what we're supposed to be doing? Are we replacing the equipments at the right time, at the end of its life cycle? Things of that nature.
Awesome. So we have, I can see the entire spectrum of operational life cycle here. We need reports that can inform you about vendor performance, contractor performance. We need reports for satisfaction, customer satisfaction, and then you also need reports around where you're spending. Are you spending it right? Where can we, can you probably plug in inefficiencies of sorts? That's great. I actually had a couple of wrapping up questions, but we have a lot of questions coming up from the audience already. So I thought which are relevant to the conversation that we are having now. I thought we'll slightly derail and go to that and pick up a few questions here. Mr. Basil Abraham is asking, can you cite some examples of current implementations of IoT from the health sector perspective? What is the current level of IoT implementation here?
Yeah. So actually, the journey that we've set on, we want to be one of the leaders in the industry. And I think, technology is one aspect of it, right? You have to have, first of all, the right workforce that is trained and skilled with you, in order to take, in order to go on this journey and achieve that success. So I think the first fundamental part is identifying the right people and upskilling them and ensuring that they have the right knowledge to take on the challenge of taking things forward. The second thing is to ensure that we're putting in the tools in place. So technology is one aspect of it. So for us, yes, definitely, we are looking at several enhancements to our facilities to make it smart, to be able to give us the information in real time, so that way we can, take care and address issues before it even strikes. We obviously have all our facilities with BMS, where we gather a lot of information from that. Now, what's important is to see all the different systems that we have. How are we integrating it through one platform? Being able to, like I said, we have close to about 400 facilities that we're trying to now bring all under the same roof. So that way we have a cockpit where we can look at the entire thing and see what issues are happening. So in terms of the IoTs, I think we have a plan that is laid out for the next 12 months. And we're in the process of, putting several IoTs on different fronts to address our issues.
Awesome. So Mr. Tom Pinnock is asking you, how do you monitor statutory compliance?
So we have a QHSE team that have an integrated management system where we have all kinds of documents recorded, and we also are, constantly look at the regulatory bodies to ensure that we are in compliance, and there's a check to ensure that we are ensuring that it is monitored. And so there's a separate team for that ensures the quality, the statutory compliance is always in check and in place.
Got it.
I see a question here from somebody that talks about if we speak commercial, how much do you expect the technology will help you in terms? See, I don't think technology alone is going to help you reduce costs. Like I said, I think the emphasis is about how do you people use the technology to monitor your operations, to identify where you have opportunities to save money. Now, I can tell you over the last 1 year, we have reduced our expenses by close to about 14 to 15%. Now that comes in with a lot of different things. I think identifying, like I said, the right skill sets and placing them in the right place and training them to ensure that they can take care of their responsibilities by setting the right KPIs and SLAs for them. Putting in technology to monitor, and see how we can optimize cost. We've obviously looked at consolidation, procurement side, looking at AMCs, trying to leverage our size to get better deals and build a stronger relationship with our suppliers and service providers. I think, so there's multiple things. I don't think I can answer that question by saying that technology alone will give you X percentage of cost reduction. I think technology enhances your ability to deliver.
Yeah. So just to add to that, an interesting anecdote is earlier we used to get questions about how much energy can Facilio save, kind of questions. And slowly, as our customers also and the market also matured, we started to these questions started dwindling down, because that's why these kind of webinars are useful, because people start looking at it from a different perspective of, hey, technology is not going to reduce your revenue, reduce your cost, reduce your energy, but it's going to be an important tool, enabler to help you reach that goal of yours. Without that in place, maybe you're probably losing out on where you can make these optimizations. So thank you for that question. And we have a follow-up question from Tom again on compliance. Do you track compliance separately, or is this on the Cmms system that you use?
There's a portion of it that you can track on the Kpis system, and there's a portion of it that we have our own mechanism of tracking that we've developed internally.
Yeah, so that's where it's important to again, just to sorry to slightly derail you, Mr. Hani. So we are actually preparing a guide which is going to be helpful for people to use as a framework to evaluate Cmms or Kpis systems, which is going to answer a lot of questions that have come up in today's session, is to how do you evaluate these tools when you are against the goals, or against the things that you want to track or not. Maybe these questions might be answered there. We will try to drop a link to all the registration soon. And as a director, how do you expect Facilio to help you achieving your KPIs? Again, it's a similar question about how can technology help you solve your KPIs, I think. Would you like to take it up, or?
Sorry, which question again? I'm sorry. I was just reading some of the questions that were coming up. I kind of lost track. Sorry.
Yeah, I'll try to post in order. So there's a question from someone anonymous asking you, how do you expect Facilio to help you achieving your KPIs? Which is in line with the earlier question, I think, of how can
I think, like I answered before, right? I think, having Facilio for us, incorporating it into our systems was primarily for the reason of seeing how do we pull all the information together so that we can function better than what we did yesterday. So I think in terms of that, we're definitely on the right path. We're still implementing it at some of the facilities. There's a big chunk of it that's already been implemented, and it enables us to at least have the starting point to start saying, okay, how do we move forward from now, which we didn't have before. So that's the first step. So I'm sure definitely having the system in place across the board would definitely help us make a lot of optimizations and business decisions to help us move forward.
That's really nice coming from a customer. Thank you so much, Mr. Hani. So someone was asking about what is the future of healthcare with IoT-driven O&M, which is what I was going to wrap it up with, asking you about where do you think is the industry heading in the next 5 to 10 years, right? What do you think is the future roadmap for healthcare operations or the role of technology in it?
So I think for anyone to stay ahead of the game, it's all going to be related to how do you efficiently use technology to drive your business forward. So I think you're going to find a lot of AI coming into play. You're going to find a lot of systems that will enable you to do better monitoring of your facilities, more smart systems, smart facilities that will be evolving, that will help minimize human intervention and try to maximize the real efficiency of your asset. I think that's where the future is going to be. So and I think people who can adopt that, implement it, and extract maximum out of that are going to be the ones who are going to be able to stand apart from the rest of them.
Awesome. Yeah, agree to it. So we are actually hitting the 40-minute mark. I'm going to quickly run through the last couple of questions. If you have any further questions, please feel free to drop it in the Q&A box. If you don't have the time to answer it now, I'll have it in written form from Mr. Hani after the session is over, and then maybe send it out an email if possible. There's only so much we can cover in this session. So what is the future? That's the one that we answered right now. What is the brand of IoT?
So yeah, I mean, I think, I don't think there's a specific brand that one should adopt. I think what you first need to understand is, what is the problem that you're trying to resolve? And then based on that, you then define what is it that you need to solve the problem. If you feel, at that stage you need an IoT, yes, there's a lot of different IoTs available in the market. And I think, it's about understanding what your needs are. And then accordingly, you'll be able to find out what best suits your need. There's a lot of different elements to answer that question, because you have a cost factor, you have, there's multiple things. So I think it's important to first understand what is the right, what is the issue that you're trying to resolve, and how, can an IoT, resolve that for you. And then you can look for a brand. I mean, there's so many good brands out there.
Got it. So imagine workplace solutions like room occupancy, temperature, humidity, and IAQ control can be very relevant to hospitals. Is this something you agree with, and how can this be implemented in healthcare?
Yeah, I think I can agree with that. I mean, temperature, humidity, and stuff with your BMS now. A lot of folks are adopting BMS in large facilities. That is something that you can always program, monitor, manage. And then, that's also connected to your CAFM solution, and that helps you, even further. Room occupancy, I think for that, is something where we are actually in the process of developing, smart solutions on an integrated platform, where we plan to integrate all this with our CAFM solution as well. So I think that is something that, you have to really see what sort of systems do you have, how are you trying to, again, it's a fundamental question, what are you trying to achieve? That needs to be answered first. Because there are things that you may not require a sophisticated technology to come into play to solve that issue. It could be something very simple that you could do by just introducing a process. I don't know if I've answered that question, but yeah.
No, yeah, I think pretty much, because again, evaluation is very like a personal journey of mapping out the requirements first, and then looking at what do I do for these set of requirements, right? So there's one last question around, what are the tools in Facilio that help technician in troubleshooting recurring issues? Maybe.
Yeah, I might not be the right person, because I'm not the person that uses it day in and day out at that level. But what I can tell you is, definitely when we were evaluating tools, one of the things that we were looking at is, if I was a technician, I think what's important for me is to understand, one, is there an issue that I need to attend to? Two, that's the reactive calls. Two, is there a schedule, a maintenance schedule that I need to follow for the course of my week, and am I able to attend to that and complete that and close it out? Things of that nature, I would think,
Yeah. Yeah. So apart from the recurring part of it, I think Facilio's mobile app has,
Right.
entire context of what this work order is about, what this issue is about, which is going to help the technicians resolve it at a faster way. And when it comes to addressing the recurring part, it's also about someone looking at this pattern of, okay, hey, here's it's similar to the example that Mr. Hani mentioned, right? There were like 30 number of calls around door issues, which is when they install the carpenter there. And so it's about finding these kind of patterns out of this reactive resolution with the context that is available in the mobile app. And there's also proactive analysis of data and patterns to then resolve it on a long-term basis, right?
Another thing I'd like to mention is we encourage a lot of our staff to look at, what are some of the issues that might have happened at some of the other facilities and what was done to resolve that, especially from the technical perspective, from an HVAC perspective, from the medical gas perspective. So, it's also something that enables people to go out there and kind of learn from other experiences that somebody else might have had across the other facility to see how, you can, and it also enables the technician to get in touch with the other technician who might have, facilitated and assisted in closing out an issue at another facility. So we promote a lot of that cross reference on what work has been done. So I think that's something technicians should extract out of the system and see how do they connect with fellow members, addressing the issues that they have and learning from them.
Awesome. Yeah, I think collaboration is key. It's also one note for technology providers to note that the tool also needs to enhance these kind of collaborations between technicians, between vendor and in-house teams, between clients and vendors, and think of these collaborative use cases when we are developing the product as such. So thank you so much, Mr. Hani. I think we are quite hitting the mark here of 45-minute session. So we will be sure to share this recording with all registrants post the session. And any questions, please feel free to drop as an email to me or Chinmay. Post the session, we'll make sure to have it answered or addressed if Mr. Hani can do based on his time. But anyway, thank you so much. It was a very, very insightful session. I actually was personally, very much, I took a lot of learnings from you, Mr. Hani, today. And looking forward to next upcoming webinars. Thank you so much for everybody who joined here. So just one note, I think there are a lot of evaluation related questions, and which gives us suggestion to have a session around how can we evaluate Cmms or Kpis system based on the different requirements, different maturity levels that an organization will have. We'll come back to you on a final plan on how this session is going to be based on. But thank you so much. So these are some contact details if you want to know more about how Facilio has helped companies like EuroHealth in going forward in their own organizational vision and journey. Thank you so much, Mr. Hani. Thank you very much.
Thank you, everybody. Yeah, have a good day.
Thank you. Thank you, everyone, for joining. Thank you. Bye.